Hello, everybody. This is Dr. Mehta, and this is another episode of um, real world problem which is commonly ignored. And what I'm talking about is your physician telling you that your blood sugar is slightly elevated, and this is the lab result you got. Um, and you were told that you need to stop eating sugar, change your diet, and come back next year. We'll recheck your sugar and see where it is. And as usually I see that most of these patients will go back next year, and next year they'll be told that their sugar is even more elevated, and maybe they need to lose some weight. And patient will try for another year, go back next year, and try to lose that weight unsuccessfully. And next time, the patient will be told that your sugar is now very high. We need to put you on medication. And patient do try to ask, why my sugar is elevated. Well, they were told that you're diabetic now, just like everybody else. Now, during this entire episode, nothing was done to address the fundamental problem which plague all of us, but there is very little awareness, let alone action. So, I'm going to discuss the root cause of this problem, which is very, very common. So, um, in this patient, what we did, we placed a continuous glucose monitor on him, which is called as Dexcom. Dexcom is a device which will record the blood sugar for continuously for 10 full days, and the data will be shared with your physician, so he can see that in real time. You can see that in real time where your sugar is going. It's an excellent way to monitor your sugar. So in this patient, we placed a continuous glucose monitor, and here are the numbers. As you can see, the maximum blood sugar went up to 251. Um, and another chart or the slide, the number went up to 215. And here it is 250, and this is all certain days, time, so everything is kind of recorded. Um, Now, I want to share with you what happened when your sugar shoots up this high. So one of the common complaint which I hear from a lot of my patients who have this type of problem is that they feel very sluggish and tired and sleepy right after eating something, and that will last them for a couple of hours, and after that they'll be fine. And they just did not know what was going on. Some people came to me with high blood pressure, which randomly shoots for no reason at all, and they did not know what was going on. They said their A1C was checked and it was normal, so they just were in dark about this. Now, a lot of these elevation of the blood sugar correlate with elevation of the blood pressure correlate with the elevation of the blood sugar, as you can see, 251. So whenever their sugar is shooting up, they are prone to develop hypertension, and sometimes the blood pressure can shoot up very high to the stroke level, and some young people end up having stroke without knowing what was going on. So I want you to understand that this is a very critical thing to understand, um, for all everybody who really worries about their health and who have a family history of diabetes, who are slightly overweight and don't know what to do. So in this patient, like I said, we did not stop here. We went further to find out the root cause of the problem. So I'm going to share another slide, which is this is particle size. Test so called as NMR lipo. Normally, in this patient, as you we can routinely see, the LDL size used to do very just a lipid parameter, which is to the know top portion of the slide. Your elevated, as you can see, the total cholesterol is 296. If your LDL cholesterol is HDL cholesterol range 46, which is green right here, then one does not need to worry that really these type of particles are called as beyond. Normally, your physician will simply they are not put you on two different medications. I can guarantee you that a lot of the why is that because they cannot get inside the cell. One is for LDL cholesterol, the other one is if the particles are small, like in this patient, and again you will be told that okay, particle will become come back next year. Smaller, less than 20.5 nanometer. So, but these particles nobody did the second part of the test slide the cell, and this is a test called as NMR lipo, oxidized version of LDL. Normally, all of this routinely is caused by used to do just a lipid panel, which is the top portion of the slide. The LP, as you can see, the total cholesterol is 296, triglyceride is 288, and in this patient is HDL cholesterol 46. And what it means is that because of insulin resistance, that really ended up scary, altering their normally your physician will simply small size put you on two different medications, and I can guarantee you that blood sugar, a lot of you and ultimately this person will become diabetic. One is for LDL cholesterol, the other one all is type of vascular problem. Again, you will be told that okay, all of this could have been avoided many years ago. Come back on an average. A lot of people will have this type of nobody did the second part of the test slide 7 years. This is a test called so you basically wasted about normally 7 years. We routinely time when used to do just a lipid panel, which is now how do we deal with this situation? As you can see, the total cholesterol is 296, that is something triglyceride is 288 for HDL cholesterol 46, and another video chat where I can that lay out really detail scary how all of this normally your physician not only correct it but normalize two different medications. I can guarantee you that a lot of the we have done that to numerous patients successfully. One is for LDL cholesterol, the other one is for lab parameter do not look like, and again you will be told that okay, so exercise and diet. This is all for now. In my next podcast and video chat, nobody did the second part of the test how to address this particular issue. This is a lot of you already had this test done, and I'm quite familiar with that. We routinely have been used to asking everybody to look into it, which is I educate everybody slide. So as you can see, the feel free to ask me any questions. Triglyceride is 288, HDL cholesterol 46, and LDL cholesterol, which is the particle size. So this is the particle size in this patient. As you can see, the LDL size is very important parameter to know if your elevated LDL is actually dangerous or not. If your LDL cholesterol is in the range which is green right here, then one does not need to worry about it. These type of particles are called as beyond particle, and they are not atherogenic. That means they do not make plaques. Why is that? Because they cannot get inside the cell to make a plaque. Now, if the particles are small, like in this patient, the particle will become smaller, less than 20.5 nanometer. These particles are dangerous because they can get inside the cell, and there it will be called as ox-LDL or oxidized version of LDL. Now, all of this is caused by one condition, which is at the bottom of the screen. As you can see, the LPIR score, which is the insulin resistance score, and in this patient is 77. And what it means is that because of insulin resistance, it ended up altering their LDL cholesterol from a large size to a small size. They end up increasing their blood sugar, and ultimately this person will become diabetic and will be exposed to all type of vascular problems. um, all of this could have been avoided many years ago. On an average, a lot of people will have this type of laboratory picture for 6 to 7 years before they'll become fully diabetic. So you basically wasted about 7 years uh, of time when something could have been done about this. Now, how do we deal with this situation? Now, that is something a topic for another video chat where I can lay out in detail how all of this could be not only corrected but normalized. Um, and we have done that to numerous patients successfully, and their lab parameters do not look like anywhere close to what it is today. So this is all for now. In my next podcast and video chat, I'm going to talk about how to address this particular issue. Now, a lot of you already had this test done and are quite familiar with that. And I have been asking everybody to look into it, and I educate everybody. So feel free to ask me any questions. I'll be more than happy to answer. So see you next time. Thank you.